Well, good afternoon, everybody, and welcome to this live Facebook forum here with Idaho News 6. I'm Matt Sizemore, one of the anchors for Good Morning Idaho. And June, as many of you may know, is Men's Health Month. And we know that a lot of males may have questions that maybe they're not asking and should be asking when it comes to their health. And we also know that a lot of men and women, but a lot of men particularly, have not been going and getting their regular checkups, their screenings, all the things that they should be doing over the past year and a half because of the pandemic. Probably started off like myself as saying, oh, maybe it's not safe to go for a very long time. And after that, you just got into a habit of not going. But we really want to talk about today why it's so important as we start to get back to normalcy, why it's so important to be getting back to your doctor, your dentist, just to whoever, to make sure that you are getting checkups for your health and taking care of yourself. So we have two wonderful guests joining us today. Our first one we want to introduce is Regents Executive Medical Director at Blue Shield of Idaho, Dr. Amy Kahn. Dr. Kahn, thank you so much for being here today.
Well, it's a pleasure to be here, Matt. Looking forward to our conversation.
Perfect. All right. Wonderful. And also our other guest is the Executive Medical Director for Primary Care at St. Alphonsus Medical Group, Dr. Michael Roach. Dr. Roach, thank you as well for being here.
You're welcome, and it's a pleasure to be here as well.
Gotcha. So we have a ton of questions, but maybe just initially, just one quick thing, maybe if you just want to talk about Men's Health Month, what would you say is June, why Men's Health Month is important?
Well, I can kick it off, and certainly Dr. Roach can follow up with me. But first of all, it's Father's Day this month. That's a wonderful opportunity to acknowledge the fathers in our lives, or the men in our lives. And I think June being Men's Health Month is a great opportunity to really call out sort of unique differences among men, and maybe what are certain factors that put individuals at greater risk, say, compared to women. It's an opportunity for us to talk about some of the health risks and opportunities to improve health and prevent chronic illnesses, and really overall enjoy a much longer lifespan. So we'll look forward to diving into the details. But as we emerge through this pandemic, it's a terrific time for us to say, hey, how do we get back into the saddle and start doing and looking at those things in our lives to improve health, and a particular focus on the men in our lives.
Very well put. Thanks, Dr. Kahn. Dr. Roach.
Well, it's a well-known fact that men underutilize healthcare services, and that can lead to significant disease, morbidity, mortality. So I think it's a wonderful thing to have June designated as Men's Health Month. I think our biggest challenge in providing healthcare to men is simply getting them into the office. There's an old saying that a man only goes to his doctor when his mother, wife, girlfriend, or partner makes him go. And to some extent, that's true. I think there's a lingering attitude that if it ain't broke, don't fix it. I don't need to see the doctor until something's wrong. And I think we really need to work hard to kind of change that attitude.
Gotcha. Perfect. Well put. All right. Well, let's get to our a couple questions that we have for you. First off, of course, we know how greatly women are impacted by several different things, such as cardiovascular health issues. We want to know, what kind of unique health risks do men have? And Dr. Kahn, why don't we start with you?
You bet. And I guess I would just again say that we stereotypically speaking, we often think about men as superheroes, the stronger sex, as it were. But the fact is that men die about 5 years sooner or younger than women. And not only are they more likely to fall ill at a younger age with some of these chronic illnesses, but they just have some risk factors that put them in a unique position such that these conditions are showing up sooner. For example, men are more likely to use substances like alcohol to excess, or to use tobacco or tobacco products, more likely to engage in unhealthy or risky choices, risky behaviors, if you will. And as Dr. Roach mentioned, put off needed medical care, particularly in the area of preventive screenings and annual checkups, which then allow some of these other issues that might be present to sort of continue to go unnoticed or unchecked and really don't manifest until they're fairly advanced or very serious.
Gotcha. Yeah, that makes sense. What do you want to add to that, Dr. Roche?
Yeah, I'd like to amplify that men do engage typically in riskier behavior. And when I counsel men, I try to talk to them about, what their greatest risks are, both in the present, what they're most likely to experience within the next few years. And then I also try to impress upon them what they may experience years, decades down the road as far as chronic illness that Dr. Kahn alluded to. It again is challenging to make contact with men at all during their younger years, their teens, their 20s and 30s. It makes this counseling difficult to deliver. So, getting the message out publicly in this kind of manner can help, even if the message only gets to those who can convince them to see their healthcare provider.
So it kind of sounds, going off of what you both said, it kind of sounds to me like the number one enemy in so many ways, especially when men are younger, are men themselves, in making sure they take care of themselves and going and seeing doctors and getting checkups.
Yes.
I would also like to comment on that. I mean, some of this is, cultural, right? I mean, to a certain extent, there are certain social factors. Men tend to be, have a lot of work stress. They tend to be maybe a little less connected in general socially. We know that's a protective risk factor, that women seem to have that more broader social connection, sort of social connectedness instead of medicine itself. Behaviors are different. Choices around diet, physical activity, things that relate to, whether you wear a seatbelt or not, using those substances, as I mentioned, much greater in men. And of course, there's biologic differences, right? The effect of testosterone, having that Y chromosome, really thinking about the anatomy of men and the relative increase in, say, muscle mass and metabolism being different. So these are sort of the underlying kind of differences. It used to be when we did medical science and research, we didn't always think about men and women as, having these differences. And a lot of our research was just based on adults. And now we recognize, women aren't just smaller men, but they're very different and they have different risk factors. Similarly, men have their own unique set of both biologic, social, and behaviors that may put them at greater risk for certain conditions.
Okay, perfect. And that all makes a lot of sense there. Now, kind of going off on that, tell us about some of and Dr. Roach, we'll start with you, some of maybe the other risk factors that men specifically face, and more importantly, or just as importantly, how can those factors be reduced?
Well, again, I divided into age groups, and in the younger age groups, I tend to counsel more heavily on safe behaviors. Basic safety, seatbelts, alcohol, substance abuse, smoking. And, men tend to, I think, ingrained in our culture, as they tend to have a sense of invincibility. And that is sometimes difficult to get through. It's hard to get them to think in terms of many years and the risks that unhealthy behaviors may have. They tend not to want to worry about them if it's going to be 40 years down the road until they have a heart attack, or 30 years. So again, that's our greatest challenge. I think men need to inherently know they still have a higher risk for heart disease. And that's if you eliminate all other factors, all other risk factors when compared to female cohorts. And cardiovascular disease is still the number one killer, so that we tend to want to focus on that also early on in the discussions and do some basic screening. But again, I go back to counseling a great deal on safety. I mean, the top three killers in adolescent males and males in their 20s are unintentional accidents, homicide, and suicide. And so I tend to try to touch on all of those when I do see this age group.
Yeah, that's eye-opening right there with those three factors that you mentioned. Dr. Kahn, is there anything you want to add to that?
Yeah, I think as individuals age, as Dr. Roach alluded to, the sort of counseling and the risk factor profile does change. It's really important to consider the contribution of family history, of course, for men and women, but for men in particular, I think about not only risks for heart disease. I'm looking at sort of underlying risks too, high blood pressure, cholesterol problems, diabetes, if you will, but also kind of getting to the behavioral health realm. Sons of alcoholic fathers, for example, are much more likely to go on to have alcohol use related problems. And so, really monitoring for that, talking about it. And again, it sort of goes back to, kind of assuring conditions in which a man can go access a primary care provider or access even a telehealth provider, a therapist, someone to speak to. It may be that the family members in that individual's life are encouraging that, but sometimes employers can put out some incentive programs to help people maybe know their numbers or go in for a preventive visit or have a primary care annual visit as something to do. And it's really an important piece because primary care physicians are uniquely positioned to assess that full range of risk factors and dive into some of those dimensions that we know predict this serious kind of consequences. In addition, cardiac, of course, we know that men are at 1 out of 2 men will get cancer in their life, right? And that's important. I mean, we need to make sure that individuals are getting timely screening for things like colorectal cancer. Now the recommendation is at age 45, right? Start that screening. And if you have a family history, of course, it becomes that much more important.
Gotcha. Okay, great stuff there. Now, the next thing I want to mention is something that we had kind of thrown around in emails leading up to this forum. It's the phrase disease burden. Now, Dr. Kahn, what exactly does that mean and how does it affect men long term?
Right. What we're really talking about by the disease burden is among the population of men, how prevalent are diseases, and in particular, we're focused on sort of chronic illnesses. We talked about heart disease, number one killer, right, followed by cancers, but things like stroke and successful suicide as a consequence of, say, depression. This burden of disease is higher in men than women, and another reason why, we need to really start tackling those barriers to accessing care and really help to raise the dialogue so that men are more aware of their risks and what they can do about them. So disease burden is an important piece because if things go unrecognized, they're much more likely to be advanced or complex at the time that they're diagnosed. Some of the other conditions, of course, that are more common in men include things like, inguinal hernias, aortic aneurysm, kidney stones, bladder cancer, even emphysema, COPD, and some of this is related to use of, say, tobacco or excess use of alcohol.
Gotcha. Okay, Dr. Roach, anything you want to add to that?
Yes, when we meet with men, I try to map out what they can expect, and I'm glad you mentioned family history because it's very important for men and women to know their family history. That's key information for their provider. It helps their provider make better decisions about screening intervals, screening schedules, and even in 20-year-olds, it helps us predict for them where they may be going health-wise. We like to try to map out what they need to do each decade as they look ahead. And I think that education is very important. And I think it's become more and more a focus of primary care.
Gotcha. Perfect. Now, one thing I just want to add to everybody that is watching right now in this forum, if you have any questions you want to ask these two wonderful doctors here about men's health, please feel free to leave those in the comments and we will get to those questions in time. One thing I wanted to ask really quick, just going off of what you both said, just kind of from my own personal knowledge there, is about heart disease. You were saying that men, the number one killer of men is heart disease. Now, would you say with that is mostly hereditary or more so in factors that men do throughout throughout their lifetimes, or just a big various combination? And whoever would like to take that, feel free.
Go ahead, doctor.
It's generally a combination. Cardiovascular disease is extremely common whether you have a family history or not. There are genetic disorders with cholesterol and lipids, for instance, that predispose patients to significant early heart disease, and it's critical that we know that family history and that a patient would know that family history. But in general, it's multiple factors. It's family history, it's lifestyle, and the basic risk factors. There are many, but there are obesity, sedentary lifestyle, smoking, high cholesterol, high blood pressure, diabetes, to name just the most common ones I see. And so those are modifiable and they're treatable. And again, the key to intervening in a timely fashion is early intervention.
Perfect. And Dr. Khan, did you want to add something?
Yeah, that's it. I mean, early intervention, I think part of it is just recognizing that, something's going to get us at the end of our life, right? And we know that heart disease is the number one killer for both men and women. About 1 out of 4 men will have heart disease. There are many modifiable risk factors, and they really roll up into this sort of lifestyle category. Environment has a contribution as well. Addressing stress, if you will, addressing inflammation has a key role in the development of heart disease. And then some of the key pieces relate to weight, managing that weight to goal, diet, making sure that diet is high or rich in fruits and vegetable and fiber and low in animal fat, making sure we're getting that at least 30 minutes a day of exercise, right? Most days of the week. These are the sorts of things that are critically important, that have really the ability to prevent the onset or delay the onset of heart disease, particularly in people who have sort of underlying factors like, family history. And then making sure that if you do have high blood pressure or hypertension, elevated blood sugar that looks like diabetes, or a thing called metabolic syndrome, which really is a constellation of factors that are highly predictive for the onset of cardiac disease. Excess belly fat, for example, unhealthy levels of triglycerides, or relatively low level of HDL or healthy cholesterol. These are factors that are extremely modifiable to, again, help prevent that heart disease onset, particularly premature heart disease, allow an individual to have a fully active life, right? The quality of life is an important part of this. So addressing those behaviors, lifestyle, our health habits, and our environment as well are going to be key, along with managing some of these chronic conditions to goal and addressing those risks that we can't change, like our family histories, that ride along with those other factors.
Perfect. Well put. Now, Dr. Khan, let me just add one more thing to that. In addition to everything you were saying in terms of diet and environmental factors and whatnot. Now, of course, this is important for everybody, men and women, but tell us about the importance of sleep and the effect that can have.
It's a great question, Matt. We're continuing to learn more about sleep and why high quality sleep is so important. We know that people who don't get at least 8 hours of sleep a day are more likely to develop things like obesity or weight gain, insulin resistance, also changes to their cholesterol profile, or what we call lipid profile, as well as potentially other conditions that affect our sleep. Obstructive sleep apnea on the rise, related to a rise in obesity and some other factors. So sleep itself is a key part of keeping us healthy, protecting our heart health in particular, and reducing even things like that inflammatory component, which we know is associated with the development of many chronic issues.
Perfect. Well put. Dr. Roach, anything you want to add on the topic of sleep importance?
Yeah, sleep apnea, where you have periodic pauses in breathing and drops in oxygen during the night, puts a significant stress on your cardiovascular system. And it's something we're seeing much, much more now with the rise in obesity.
Gotcha. Okay, great. Thanks for that addition. Now, this morning on Good Morning Idaho, we had a doctor on who talked about basically the decline in prostate cancer screening during the pandemic, which, of course, is something huge for men. First off, Dr. Roach, tell us a little bit about why it's so important for men after a certain age, or you can tell us which age exactly, why it's so important for men to be going and getting their prostates screened, and what other health checks are recommended specifically for men?
Well, prostate cancer is a very interesting topic because there have been many changes in recommendations and maybe no consistent consensus in recommendations over the past few years. Yeah, as a general rule, there are higher risk groups, Black men in particular, as well as men who have a first-degree relative who had prostate cancer before age 65 are at increased risk. So you may consider starting a discussion of prostate cancer screening for those men even in their 40s. We used to start talking about it in the average risk patient when they're 50. There's some feeling now that that doesn't really need to start until age 55 to 70. You don't really talk about prostate cancer screening in any man of any age who has less than a 10-year life expectancy. So what it really comes down to is what's called a shared decision-making discussion with a patient. You take into account their risk factors, including their family history, their desire to be screened. You need to talk about the risks and benefits of screening, and that there probably isn't a consensus on a particular age at which to start that. I personally feel it's very important to do screening. Many men will do fine with every other year screening. There are some recommendations that you screen every year if your PSA, your prostate-specific antigen, which is the blood test we use for screening, is above a certain threshold. If it remains below that threshold, every other year to every 4-year screening is probably acceptable. So given that we are just coming out of a pandemic and much of that screening may have been delayed, may not be a huge factor in prostate cancer because many of those men wouldn't have needed screening in the past year anyway. Prostate cancer tends to be a very slow-growing cancer in most cases. So as far as prostate cancer goes, the delay in screening may not have a significant impact. I'd be very interested in hearing Dr. Kahn's thoughts on that as well.
Yeah, thank you for sharing that. I concur. The interesting thing about prostate cancer is that there hasn't been a clear set of guidance. There are many different professional organizations have various recommendations. It's a decision that's best left between a man and their provider, their physician, to talk with them about the risks versus the benefits of screening, recognizing that for some individuals, there's potential harms with screenings where the cancer, perhaps even the workup for prostate cancer, might have some side effects that are permanent, if you will, for that individual. So there's lots of important components of that. A shared decision-making approach makes good sense. Now, I would contrast that with what I mentioned about colorectal cancer screening. And we do know that upwards of 40% or more of Americans postponed recommended preventive services this past year. Colorectal cancer is on the rise, particularly for the younger set, if you will, persons under the age of 55. Certainly now we lowered the recommended screening age to begin at age 45. We know it's more common among African American men, also among persons who have a family history of colon cancer or have what's called familial polyposis, a condition that might put you at more heritable risk for colorectal cancer. So for those folks, I would say there are a number of options to explore on how to be screened. Certainly colonoscopy is considered the gold standard, but even some of our highly sensitive fecal tests that are available are really helpful in identifying the presence of colorectal cancer. And an approach that, I would say is if you haven't gotten your annual here, if you skipped it last year, it's a good time to go in and see your doctor. Have a discussion about, hey, what are my risk factors? What might I need in terms of cancer screening screening. And then, of course, if you haven't had a profile done to look at, say, fasting blood sugar to check with diabetes, or a lipid panel to look at those cholesterol levels, this is a good time. Not to mention getting your measurements, knowing your weight. The median amount of weight gain this past year alone was 15 pounds for the 40% of so of persons who gained weight this past year. And that could tip the scale, literally, so that people who might have been pre-diabetic are now diabetic, or perhaps didn't have a cholesterol lipid problem. Maybe they do now. So this is an important piece, getting that blood pressure checked. So in addition to those cancer screening approaches, colorectal cancer, certainly prostate cancer discussion, lung cancer screening for those who are tobacco users and have smoked for a significant amount of time in their life may have an opportunity for low-dose CT to screen for lung cancer. Again, those three cancers being representative of the majority that men get.
Okay, a lot of things to get checked for men for sure. Very important there. Dr. Khan, let me start with, go ahead, Dr. Roach.
Yeah, I'd just like to add on to that
Yeah.
prostate cancer is a relatively slow-growing cancer. These other cancers are not. And I think I'm more concerned with the delay in colonoscopies, the delay in lung cancer screening. These are cancers that can, in a year's time, advance significantly. And so, we've had a real focus in trying to increase lung cancer screening in general in our group. But I think we really need to be focused on those who perhaps did not get their annual low-dose CT scan or have not entered a screening program yet.
Okay, good tip there.
And
go ahead, sorry.
Just to add on, the lung cancer screening criteria recently were changed by the United States Preventive Service Task Force, and it's now anyone age 50 to 80 who has a 20-pack year smoking history or more, or has quit within the past 15 years. So they've actually broadened the qualifications for lung cancer screening.
Wow, within the last 15 years. Okay, good to know there. Dr. Khan, I want to start with you for this next one. Obviously, in the past year, it wasn't just men, women also, but I know a lot of men, including myself, kind of let go in a way because it's been impossible to go to a gym. You're just indoors. You get bored. You eat. It's unfortunate. Some of just the many unfortunate side effects to this pandemic we've gone through. So, what would you say to men who maybe are a part of this, have been affected by this, to make sure they make those lifestyle changes? What kind of lifestyle changes or practices should men go through?
Well, thanks for the question, Matt. One thing that can be really motivating for men is there tends to be a kind of a competitive edge, if you will. Have people kind of get back in the saddle, get in, what's my weight? Did I gain weight? And if so, what is my optimal weight? Even a modest amount of weight loss, say 3%, can make a huge difference on your blood pressure profile, your lipids, your blood sugar. Get moving again, right? And to your point, a lot's changed. Many of us are not going back into the offices regularly, or have changed the place or how we do our work. It may be that you need to be creative, right? Maybe find a spot in your home or around your neighborhood that you can just schedule and then participate in some kind of a challenge for yourself, or maybe with a buddy. Say, hey, listen, we need to get on the program together. How about if we do whatever? Maybe it's a companion that you start walking with, or maybe get back and start maybe playing racquetball or getting out on the golf course, but walking the course. These are ways that we can just start changing how we think about it. Our underlying health is critical, and yes, we've moved through this pandemic, but there's threats still out there. One could be if the virus changed significantly, but other types of risks, other infections. So our underlying sort of strength, if you will, our health is so critical. And we did see through the pandemic, those who had chronic health issues, were more vulnerable. So, some of the things that I'd like to sort of share have to do with what's motivating to you, right? Maybe it's hanging out and playing with your grandkids or your own children, being able to, play pass a football or play some frisbee or whatever it is. But these are things that are important to kind of reclaim. And getting social about it can also be really compelling, can be very motivating, and allow you to achieve those goals.
Perfect. I like that a lot. What's motivating to you? Make that happen. All right, Dr. Roach, what would you like to add to that?
Yeah, I think that critical question is what means the most to you? What is important to you? And can you do those things? And how can we help you get back to doing the things you want to do, whether it's things you may have given up because weight gain or overuse of alcohol. We do know that there was an increase in, probably a significant increase in alcohol use, perhaps more in women than men over the last year. I think another thing we really should mention is that 2020 was stressful beyond just the pandemic. It was a very contentious political year. There is palpable anger and stress that I see in patients. And we know that those psychosocial stressors contribute to more rapidly developing cardiovascular disease and cancers and affect the immune system. So we have done a lot of stress counseling over the last several months. And I do encourage people to get more active. Even if it's just taking a walk, I try to sell people on the mental health benefits of exercise and exercising with a companion if they can, even if it's just taking a walk in the evening. I think it has mental health benefits as well as physical benefits.
Perfect. Gotcha. All right. Well, I think we are almost out of questions, but one thing, I know we've gone over this quite a bit already, but what would you both, and Dr. Roach, we'll start with you. What would you tell a male patient who's maybe stubborn, maybe someone who just doesn't want to come into the office, like we were saying, those invincible males that haven't been to the doctor in who knows how long? What would you tell them in order to make them come in for a screening, a checkup, or whatever it is to make sure that they're staying safe and healthy?
Well, I know that shaming and trying to make them feel guilty does not work. I really rely on education. I try to just make them understand the importance of maintaining their current activity level. Most men or most of any patient, they want to be able to do the things they want to do. So I tie my recommendations to that. I tell them I want them to be able to do what they want to do. And here's the potential barriers, whether it's a cancer that's undiagnosed or cardiovascular disease or stress or depression. I want them to be able to continue to do what they want to do, whether they're 25 or 85. And I think that's the message I try to carry to them.
Perfect. Dr. Kahn.
Yeah, I think kind of getting to that, what's going to be motivating is really core. One of the approaches that, I've certainly used, whether it be in counseling someone who might be overusing alcohol or using tobacco products, or perhaps even those that need to be a little bit more motivated in managing chronic conditions, is be very honest and say, wow, what does it feel like when I say that, there are a number of lifestyle changes that could be hugely impactful to improve not only your lifespan, but your quality of life, and allow that person to sort of try that on. Most people don't want to hear that they're not going to live to see their, grandkids graduate or get married or, get to enjoy some of those later years, as it were, or, feel that where the trajectory they're on is going to be compromising to, quote, what they want to do. And so by putting it back to an individual, say, how's that feel to you? And what would it take for you to say, make better food choices, right? Less fast food, less heavy meats, but maybe choose more vegetables or choose less fatty items, or really reduce caloric intake to drop the, critical 20 pounds. And again, start that kind of partnership, if you will, in a very honest way, but that allows that individual to start thinking through and allows them to articulate what for them would make a difference. And it's always been humbling to me as a primary care physician, to see and hear what people say, because the things that I think are important aren't necessarily going to mean much to them. But when they have to actually try it on and say, wow, when you put it that way, this is what really resonates with me. So I think it's just having a relationship with a clinician. Sometimes behavioral health therapists can help this process, but to allow an individual to have a space and place to be able to engage, to really say, hey, my health is a priority and is important to me because of X, Y, or Z, and here's what I'm willing to do to make a difference or to improve my health status.
Wonderfully stated there, Dr. Kahn. Now, I want to pick out one thing that you said right there, and expand it into a different question, if you will. You had mentioned that one big motivating factor can be your children or your grandchildren. Let's talk about that a little. I know for myself, as a new father, I'm starting to think about my longevity in terms of sticking around for her for who knows how long. So tell me a little bit about how making the right choices, staying healthy, and all this can affect your children or even grandchildren.
Wow, there's so much packed into that, Matt, right?
Yeah.
So part of this is, I'd say, look at, part of it is I'm a late in life parent. So for us and my husband, it is really about us staying around for our very active teenager now. And part of it is he's a pretty active guy, really athletic, and I can't keep up with him anymore. And I'll give you an example. We love to ski. Well, I can't ski the kind of stuff he does. So I say, hey, tell you what, I'll meet you at the lift because I got to go down this groomer, right? I want to be intact to be able to continue to ski with him for the next several years, right? It's a really simple example, but certainly, within moderation, you want to be able to stay with them through their journey. But the other part that you mentioned, you've got this young child, you are imparting all kinds of, information, lifestyle, culture to your child. You're teaching that individual how to eat. They're watching you. So if you're going for the healthy products, you're letting them know that exercise is a value of real importance or priority. You're not only assuring your own health to be able to stick around for them, but you're giving them such a gift, right? Because there will be periods in their life when they're hanging out with their friends, maybe they're into fast food or candy or whatever, but at the end of the day, they're going to go, this is kind of my go-to thing. We eat this, we don't eat that, or that in moderation, what have you. We exercise, it becomes part of their values. So you really get to impact not only you and their relationship with them, but their health for their lifetime.
Dr. Kahn, you're getting me motivated. I like this. Thank you for that. Dr. Roach, what do you want to add to that?
I'd just like to add there's enough potential for bad things to happen to us from a health standpoint at any age, and that, so take care of the things you can take care of. Address the modifiable risk factors and focus on prevention. And it's very stressful for children to have ill parents, especially young age if the parents are young. And so, you don't want to put them through that, and just take care of yourself.
That's right. That's a good thing to nearly end on. Just take care of yourself. Come on, guys. All right. I think we are just about, or at least myself, I'm just about out of questions. I'm not seeing any in the comments as of now. So if there are any from our people behind the scenes that I don't see, please let me know and get those out there. But in the meantime, I want to just ask you both, and Dr. Roach, we can start with you in terms of Men's Health Month. Are there any parting words or that you want to get out there, or maybe anything that maybe we have not, any topics we have not hit on that you wanted to talk about?
I would just like to come back and encourage men to establish care with a provider. It's not a sign of weakness. There's a great deal of fear I sense in men that we are going to find something wrong. I think the opportunity to prevent something bad far outweighs the probability of us finding something wrong. I think you really should establish care with a provider that you can develop a rapport with, who you feel comfortable with, and who can guide you through these healthcare decisions and decisions about screening, and make recommendations based on your specific health history, family history, and risk factors.
Perfect. Thanks for that. And Dr. Khan?
Yes, I would like to just echo those comments. Having a primary care provider can go a long way in helping you stay the course, can help inform you about opportunities to improve your health. So many of your risks are modifiable, and knowledge is power. So you definitely want to echo that. I'm wearing blue today because this Friday, I want to encourage everybody to wear blue as a reminder to encourage men to live longer and healthier lives. And really want to thank you, Matt, and the crew there at your team that this is a really important topic. And so if we don't do anything else, just in the men in our life, just make sure that they are, aware of their options and getting in to get that needed care, and really kind of taking a look at some of those health behaviors that can be so critical in improving overall health.
Absolutely. Well, I really appreciate you both being here, not only for the station as well as the other men that are tuning in right now, but myself as well, because this is great motivation. To be completely honest, I've been on this earth now for a while, and I don't think I knew that June was Men's Health Month, to be completely honest. So I kind of like something we've all talked about and established. Men in so many cases feel like supermen. Oh, we don't want to talk about our health. We're fine. So it's good to in a lot of cases kind of be vulnerable about this, and just let everybody know, we're human too, though we pretend not to be. So so I just want to thank you both. My guest today, of course, Dr. Amy Khan, Regents Executive Medical Director of Blue Shield of Idaho, as well as Executive Medical Director for Primary Care at St. Alphonsus Medical Group, Dr. Michael Roach. Thank you both so much for your time today and all the wonderful insight, and hope to talk to you very soon. And thank you, everybody, for tuning in.
Thanks, Matt. Happy Father's Day.